Bismillahir Rahmanir Rahim. So, resuming the MCQs of the gynae pink, coming toward this MCQ, that is MCQ number 24. So, the baby after delivery, what will happen? So, that is a straightforward question. The lung compliance increases because inside the uterus the lung is in collapsed position, but as the baby is born, what happens? The lung expands. When the lung expands, so expansion mean the lung compliance increases. So with this, two other MCQs that comes into my mind is, in COPD or chronic bronchitis or in obstructive diseases, what happens to the compliance? That is increases, because in obstructive disease what happens? There is air trapping and there is expansion of the lung. When there is expansion of the lung, it means increased compliance. So obstructive diseases leads to increase in compliance. Restrictive diseases, what happens to the compliance? Decreases. And another MCQ that is usually asked is surfactant. Surfactant causes what? Decreases surface tension or increases surface tension? The answer is it decreases surface tension. Another MCQ is surfactant increase compliance or decrease compliance? Surfactant decreases surface tension and it increases compliance. Surfactant deficiency causes collapse. This is another MCQ. Surfactant deficiency causes collapse. Another MCQ that comes into my mind is, if there is a collapse, the mediastinum will move toward the same side or opposite? Same side. Now option A, RBC increase in number. Actually the RBC decrease in number. Initially there is polycythemia, but what happens when there is oxygen coming toward the lungs and to the blood, what happens? That oxygenation decreases erythropoietin level and that resolves polycythemia. The bilirubin level increases in 7 to 14 days after birth. That is not in every case. Weight increases in the first week. That is not the right option. There is no significant increase in weight gain. So the lung compliance is increased. A 50-year-old smoker works in a tire factory diagnosed as a transitional cell carcinoma. What is the cause of this disease? Now over here, if you see, they have mentioned the smoker. So 50-year-old smoker. Now there are two risk factors: smoker and tire factory for CA bladder. CA bladder. So most common is smoking. After smoking, then this is the tire factory or aromatic amines. But over here, this is smoker. What is the most common? CA, bladder CA, that is transitional cell carcinoma. Second most common is squamous cell carcinoma. For the squamous cell carcinoma, most common cause is chronic irritation from schistosomiasis. So they will confuse you regarding the term. If they mention the word squamous cell carcinoma, think of chronic irritation such as catheter, prolonged catheter, urinary catheter, recurrent infections. But schistosomiasis, they will there are a lot of MCQs regarding the squamous cell CA, and they have given the option schistosomiasis. So over here, that is the smoker. If you remove the smoker and there is only tire factory, what will be the answer? Aromatic amines, nitrosamine, CCl4. So it is then aromatic amines. Aromatic amines. And among the aromatic amines, what is the most common? That is naphthalamine. Naphthalamine is the most common aromatic amine. Well, every statement or every word that I utter is actually an MCQ. You have to memorize that. So aromatic amine, and in aromatic amine most common is naphthalamine. So coming toward next. Regarding breast, the following is not true. Cooper's ligament attaches its firmly to the underlying chest wall, that is a normal, And there is another MCQ on that the shape of the breast is maintained, the globular shape. That is, it is not pendulous, it is not droopy. It is because of this corpus ligament. It attaches. There are a lot of corpus ligament inside, and that attaches the breast to the chest wall. And there is another MCQ that there are pitting. Pitting is seen in the CA or inflammatory condition. Why? Because the ligaments they become fibrosed. When they become fibrosed, what happens? They contract. When they contract, so they pierces the skin. When they pierces the skin, there is dipping. So dipping or pitting that is seen in the CA is because of the inflammatory contraction of these ligaments. So B extends from the mid-sternum to the mid-clavicular line. So it is not from the mid-sternum to the mid-clavicular line. It extends beyond the mid-clavicular line. The breast does not stop at the mid-clavicular line. If you see, it starts from the mid-sternum, but if you follow laterally, it actually extends beyond the mid-clavicular line. So that is the right option. Regarding breast, the following is not true. The option A is true. The option C is also true. The main lymphatic drainage is axillary, and I have discussed in the previous lecture. It is the most common site for CA is the outer upper quadrant. The outer upper quadrant. Uterus prolapsed but anus is in position. Which ligament is intact? Now the answer to this question is pelvic diaphragm, because the pelvic diaphragm it gives support to what? To both, to the anus and to the uterus, to both. So if the uterus is prolapsed but the anus is in position, so choose the option pelvic diaphragm. Percentage that is calculated by dividing total number of item and multiplying by 100. That is the statement. After the birth of baby, the perinatal mortality rate and stillbirth can be calculated in. Now that they are talking about the perinatal mortality rate. Well, the perinatal mortality rate is after the period of viability till first week after birth. Let's suppose there is conception. After conception up to period of viability. Now from the period of viability till the first week of birth, this whole actually demonstrate what? It shows what? Perinatal mortality. After the period of viability and first week after birth, perinatal mortality. And the stillbirth means after period of viability, if there is a birth but the person, the fetus is dead. Before period of viability, if the fetus is dead, that is miscarriage. That is actually a definition between a discrimination. What is a miscarriage? That is before period of viability, if there is a loss of pregnancy, this is miscarriage. After period of viability, if there is a loss of pregnancy, this is stillbirth. And perinatal mortality, it includes after period of viability and first week after birth. This is perinatal mortality. So the answer over here is 1 week. Answer over here is 1 week. And the period of viability is 24 to 28 weeks. Usually 24 weeks. 30. MCQ number 30. 10% formaldehyde is used for sending specimen, biopsy specimen Y. Now there are different MCQ on this. For fixation, is the right answer is fixation. What is meant by fixation? Denaturing protein. Now over here the option they have given. To denature protein. First answer is fixation. And what is meant by fixation? That is to denature protein. And they have given the description. Enzymes or protein denaturing enzyme protein will prevent autolysis. So to prevent the autolysis, the anal canal extend between the levator ani and the anus. Straightforward. About the collagen, option A, formed by chondroblast. No, it is formed by fibroblast. Present in all types of connective tissue. Yes, collagen is the key element of all type of connective tissue. Coming toward next, stroke volume. Stroke volume is increased by increase in heart rate at constant cardiac output. Now you have to understand this. This is the formula for cardiac output I have already written. Cardiac output is equal to heart rate into stroke volume. Now the question says keeping the cardiac output constant. Now if you keep the cardiac output constant, if this thing is constant, and now if you increase the heart rate, the stroke volume will decrease. The stroke volume will be decreased. You have to understand this concept. This is a little mathematics. Cardiac output is constant. You are having two things, the heart rate and stroke volume. If you are increasing the heart rate, actually the stroke volume will decrease to give a constant value. So that is not the right option. No change by increasing end diastolic volume. Yes, that is the right option. If the end diastolic volume is decreased, according to the Frank-Starling law, there will be more force of contraction. If there is more force of contraction, then the cardiac output, then there is more stroke volume. If there is more stroke volume, then there is more cardiac output. If there is more cardiac output, there is more systolic BP. There is more systolic BP because the blood pressure is equal to cardiac output and to peripheral resistance. This is formula. If you are increasing the cardiac output, you are increasing the blood pressure. But which blood pressure is increased by increasing the cardiac output? Systolic. Which blood pressure is increased by increasing the peripheral resistance? Diastolic. So coming toward next, growth hormone secretion is increased by, this is exercise. It is mentioned in Guyton. Exercise increases the growth hormone. Severe transfusion reaction occurs when A positive blood is given to, now if you see this MCQ, they have given you two things, the A group and the positivity. If you are introducing the blood to a person, you have to look for two things, the ABO system and the RH system. Now you are introducing the A antigen and the plus antigen. Now out of the given option, you have to look the dead blood group in which the antibodies for both are present. If you see the A negative has no antibodies against A and it has no antibodies against RH antigen. Or it may have antibodies later on. After first transfusion, there is actually priming, just like RH incompatibility. Like after second or repeating transfusion, there will be reaction, but this is not severe during the first transfusion. Coming toward this, the second also has an AB negative. So if you are introducing the A positive, there are no antibodies against A positive. Now if you are adding A positive blood to the O negative, what will happen? The O blood is having antibodies against A and it may have antibody against positivity depending upon the exposure. But if this kind of MCQ come in the exam, you have to clear your concept because there may be poor recall. So severe transfusion reaction occurs when the A positive blood is given to O negative. And I have explained the ABO incompatibility and the RH incompatibility on my channel. That what is the universal donor of RBC, what is the universal recipient of RBC, what is the universal donor of plasma, and what is the universal recipient of plasma. So you have to apply that criteria and that will give you the basic concept. Now over here, if you introduce A positive to A negative, there will be least reaction. If you introduce A positive to AB negative, because there is no antibodies against A and no antibodies against positive, because this is the first transfusion. Now if you introduce this to the O negative, now the O negative has got no antigen, but it has got antibodies against the A, so there will be more chances of increased severe reaction. So the correct answer over here is O negative. Hormonal therapy against malignant condition acts by apoptosis. There is programmed cell death. Coming toward the next, after 48 hours starvation, the source of energy for the body is triglyceride. Now I will add over here the bonus MCQs to prove my this statement correct. I will give a reference from the USMLE step 2. Coming toward that. Now this is that MCQ. A 38-year-old imprisoned man is brought to the physician after going on a hunger strike for 36 hours. Now read that scenario carefully. After that, focus on this tip. The hepatic glycogen stores are depleted after 12 to 24 hours of starvation. Now this is very important. This is very controversial MCQ. The hepatic glycogen stores, it means the source of energy is a glucose during fasting, that for 12 to 24 hours, not more than 24 hours. If after 24 hours, what happens? The gluconeogenesis starts. You see the gluconeogenesis. This is USMLE step 2 reference. So after 24 hours, that is gluconeogenesis, and the gluconeogenesis take place in the liver. Now there is another MCQ. A cirrhotic patient comes to you after the fasting for 36 hours. Now you know that in cirrhosis, the liver has no glycogen store. So in that condition, where will be gluconeogenesis? Renal cortex. The answer is renal cortex. So this was the right option. That is actually is an enzyme of gluconeogenesis that catalyzes the irreversible conversion of oxaloacetate into phosphopiene. The main thing that I was trying to communicate, or that I was trying to give you the duration, that was 12 to 24 hours, that is glucose, glycogen, liver glycogen. After 24 hours, that is gluconeogenesis. But gluconeogenesis, the main fuel for gluconeogenesis is amino acid and fatty acids. Amino acids and fatty acids. Amino acids and fatty acids. So coming toward another MCQ, again fasting, that is the primary source of glucose, and this is actually asking about the mitochondrial enzyme. So you have not to go into the detail. These are very complex scenarios, but again they are asking about 24 hours of fasting, that is hepatic gluconeogenesis after 24 hours. So coming toward next, that is that MCQ, renal cortex. A patient is having alcoholic cirrhosis. Now in this condition, glucose comes from the kidneys, renal cortex, and this is the bonus MCQ. All amino acids except leucine and lysine can be used as substrate for gluconeogenesis. And I was looking for another MCQ. I think I have missed that, but the question is that why the skeletal muscle has also glycogen. The liver has also glycogen. The liver gave glucose when the blood has low glucose. From the liver, the glucose is released, but from the muscle, glucose is not released. Why? Because there is an enzyme deficiency. There is enzyme that is present in the liver but not present in the skeletal muscle. That is glucose 6-phosphatase, I think. That is phosphatase enzyme. This is that enzyme, glucose 6-phosphatase, and it is asked in the fcps first papers. Glucose 6-phosphatase. So the answer over here is the triglycerides. Another MCQ is which portion of fatty acid can be used for energy? That is glycerol. This is another MCQ that comes in FCPS. Now the muscle protein that is used later on, after the whole stores of the triglyceride is finished, then the muscle protein comes into action, and the amino acid that is present in the blood. So if over here, if they ask about the blood amino acids, then that is the right option, and if the blood amino acid is not mentioned, then triglycerides. The following is true about inflammation. This is local response to injury, not systemic response. local response to injury. Straightforward question. Now pressure in aorta least during T wave, isovolumetric relaxation, isovolumetric contraction, and U wave. Now there are 3 videos on my channel. You can watch on my channel. My channel is Nasser and Dr. Jahangir TV. You type that in the YouTube. So you can watch 3 videos on that. One is the cardiac cycle part first, part second, and third part. So in these 3, I have given the main concept, and if you watch these 3 videos, you will not, inshallah, make the false option during exam. You will correct all the MCQ. Now over here, that is the isovolumetric contraction. Now I will show you a diagram over here. Now this is their diagram, and you have to keep this diagram in mind. I have made almost 10 to 15 MCQ in that video, cardiac cycle part first, part second, and part third. Now the question was the aortic pressure is least during. Now focus on the aortic curve. This is the aortic pressure, the dotted line that I encircled. Now where it is lowest? Here it is lowest, then it goes up, then down, goes up and down. Now which portion is this? Isovolumetric contraction. Simple isovolumetric contraction. Simple. Now coming down, which heart sound is produced? S1. Simple. If you remember this diagram, you can actually do any kind of MCQ that comes from this. Now if they ask about another MCQ that are given, the atrial pressure, ventricular pressure, the ventricular volume, the waves, the T wave, I have made a detailed video on this on the cardiac cycle part 1, 2, and 3. You can watch it from there. But right now the question was the aortic pressure is least during, that is isovolumetric contraction, because that is very low at that time. You have to focus on this thing. Is it aorta? Is it ventricle? Is it atrium? These 3 are different things. Aortic pressure, ventricular pressure, or atrial pressure. A woman with chest pain, already discussed in detail in my previous videos. A patient is having chest pain that become worse on lying. That is pericarditis, because when you lie down, the pericardium stretches. When it stretches, it sends signals. But if a patient is having epigastric pain or abdominal pain that works with lying down, then that is pancreatitis. For pleuritis, the pain, it increases with coughing. The pain increases with coughing for pleuritis. So you have to keep this in mind. Another is a statement. So coming toward MCQ number 42, local anesthesia crosses placenta through passive diffusion. Over here, simple diffusion, because simple diffusion is a passive diffusion. Now edema is caused by decreased hydrostatic pressure, increased osmotic pressure, lymphatic obstruction, increased albumin. Now this is there are other MCQ like this. This is poor recall, because the hydrostatic, we are having 2 things. You are having the blood vessel and you are having the interstitium. Now you are having the hydrostatic pressure in the vessel and oncotic pressure in the vessel, and you are having the hydrostatic pressure in the interstitium and oncotic pressure in the interstitium. So if the oncotic pressure in the interstitium it is increased, it will draws water from the blood vessel, so there will be edema. And if the hydrostatic pressure is increased in the blood vessel, so it will push the water into the interstitium, and that will cause edema. Or if the oncotic pressure in the blood vessel is decreased, what happened? The fluid will leaks into the interstitium and there will be edema. And if the hydrostatic pressure in the interstitium is decreased, what will happen? If the hydrostatic pressure in the interstitium is decreased, that is actually having least effect as compared to the other, because that will actually not causing that much edema. So the correct answer over here is lymphatic obstruction. C, lymphatic obstruction. Decrease in hydrostatic pressure where? Vessel or interstitium, not clear. So keep the mind clear. Increase in osmotic pressure where? Blood vessel or interstitium. So the hydrostatic pressure in the blood vessel, if it is increased, or the oncotic pressure in the blood vessel, if it is decreased, it will cause edema. Or the hydrostatic pressure in the interstitium, if it is decreased, and the oncotic pressure in the interstitium, if it is increased, it will cause edema. Now if there is lymphatic obstruction, what will happen? There will be back flow. If there is increase in back flow, what happens inside the capillaries and vessels? There is increase in hydrostatic pressure in the blood vessel and the fluid will leak out. So the option is C.